Hi there, I'm Dr. Chris Rayo from Unison Pro-Youth Institute in Stuart, Florida. I'm going to talk about traditional medicine versus concierge medicine. Specifically, concierge medicine, the things that I do here that really you can't get anywhere else in the world. Functional medicine, integrative medicine, cutting edge, anti-aging. I don't care for that term, and that's why I have Unison Pro-Youth Institute. Unison meaning one track, one place, one you. Pro-youth meaning pro-health, pro-aging. We don't, anti-aging would be you don't want the patient to live long, right? That's not what we want. We want the quality of life health span, not just lifespan. So traditional medicine, it's based, I hate to say traditional healthcare system because it's really an illness-based system. Most physicians out there were trained in the sickest people in stage in the ICU and such. So we may be pretty good at treating in-stage disease, people that are chronically ill, probably the last 6 months of their life. A very reactive system, very risky in that, medical mistakes being, some say, the fourth biggest killer out there. So it's expensive and very risky. Traditional medicine based on illness, you have to have a diagnosis code first, right? To get any lab work, a visit, a referral, images, prescriptions, etc. And then you have to deal with insurance as well that denies many things, if not most things, that you may need. They say what's medically necessary or not these days. So it's a reactive system, very risky, very expensive. Traditional medicine is that way. Integrative health, concierge, etc., where you have a membership, the focus is mainly, as in here, it's based on the qualifications and expertise I have, which are unmatched, really, I feel, worldwide. 3 decades of teaching, being an author and lecturer, the author of the Midlife Health Guide for Women series, which began in 2010. This is the latest edition, 2025, along with the Midlife Health Guide for Men. First edition being in 2007, when they had no men's health books out at all, and nothing about the importance of getting your health straight in middle age, which I termed midlife. Okay, these were featured in the New York Times in June 2025. You can go to the website. You can easily get a copy of those. If you come in for a complimentary consult, no obligation, I'll be more than glad to sign a copy for you. Anyway, integrative functional health, concierge and such, that's what we've done. It's a membership and it's focused on optimizing your health, looking at the root causes inside. For example, inflammation, the hormonal changes which occur as we age, that sets us up for the metabolic syndrome, diabetes, high blood pressure, cholesterol, that visceral fat that inflames all the vital internal organs in there, from the liver, causing fatty liver, the biggest reason for liver transplant, causing inflammation in coronary vessels that increase your risk for heart attack and stroke, the pancreas and the like. So we look at the root causes, the things we're taught in medical school, go through all those years and all of those books, right? To learn the root causes, and we work on those. We don't just treat a Band-Aid approach to treat, let's say if it's inflammation, you may, the person has inflamed coronary vessels, they get a stent or a bypass, they feel okay with that if they're lucky, survive well after cardiac rehab and being on more drugs and may have congestive heart failure from that. Inflammation is still there, the root cause, so they come down with a prostate cancer the next year or such. We've got to treat the root causes in the safest, proven ways to optimize one's health now and to eliminate the declination. It's expected that the woman that turns 65 today will spend the last 7 years of her life in a very debilitated state. One of the main things that I focus on, the 2 pillars as we age, one is preventing frailty, okay? And the other is preserving and optimizing brain health, all right? Brain health is something that is tremendously overlooked by today's healthcare system. Again, I hate to use that term because it's an illness-based system. If you need a stent or a chemotherapy, no problem with that. If your brain is starting to suffer things, signs of early dementia, there's nothing to be done. So it's just, you're told it's part of getting older, like most of the things. You may go into the doctor's office, you don't feel like yourself, or you're trying to diet and exercise the most that you've ever done, you're not seeing the results, probably it's internal things going on that has too much momentum at the current time for you to see any results from that. We have to start to get things in sync again. It is never too late to optimize your health, nor is it too early, to start to optimize one's health. So it's a membership. So it's not for here. It's not like the cost shifting and stuff. You're paying for my expertise and qualifications I have as a pioneer doctor in this for more than 3 decades, and the qualifications and expertise I have. You're going to see the medical doctor each time. We work you in the same day. If there's something going on, weekends, 24/7, even holidays, we're there for you. We help to arrange your referrals. Today's, I hate to use it again, healthcare system, illness-based, crisis-based system, impossible to navigate today. With the hassles with insurance, getting into the specialists and all that. I've been in this area since '96. I know all of the physicians that's been around here a while, and I can communicate with them directly to get you in and to get you the help that you need. Additionally, I'm on staff across the street at Cleveland Clinic North, so I can help to supervise things to make sure that you're being helped and not harmed. But the idea of this, we're proactive, so we're trying to prevent you from going to the hospital in the first place. Again, it's a dangerous place, and it's very expensive. So the main thing is to be proactive about things. I partner up with you. I'm your doctor. It's like in the old days where you have a doctor for a long time. They know you. We have excellent staff. We provide you with the best service and the best care that you can ever get. Again, things you get here, you can't get worldwide. We also have the M-Sculpt, the functional machines like the ExoMind with transcranial magnetic stimulation, helps with a myriad of mental and cognitive issues. We have the M-Sculpt, which is a cutting edge machine, although FDA approved back in 2018, to both diminish by 30% visceral and peripheral fat, and to increase muscle mass and strength by 25%. No other machine does that. And again, it's part of an integrative way, that getting the hormones optimized, the proper nutrition, and the proper exercise, okay? So that's the things that we do here. Traditional medicine fails most of the time, I hate to say it, but this is the route to go, is concierge, not just a regular concierge, but coming here to Unison Pro-Youth Institute, where we provide things you can't get anywhere else in the world under one roof. Unison Pro-Youth, Unison, one track, one place, one you, and Pro-Youth, Pro-Aging, Pro-Health, to optimize your health now and prevent problems on down the road. Thank you.